Governor Greg Abbott says Texas has multiple plans in place to tackle any possible spread of coronavirus in the state.
We are preparing for all possible contingencies. DSHS is surveying varying levels of patient care capacity around the state to contingency plan for a scenario if the state has a community spread of COVID-19. I cannot emphasize enough that has not happened. Our goal is to make sure we're prepared if something like that were to happen.
The Centers for Disease Control and Prevention say so far Texas has isolated 10 people who tested positive for COVID-19 or coronavirus. All of them landed at Joint Base San Antonio after evacuating Wuhan or from the Diamond Princess cruise ship.
All of those individuals who have tested positive are currently in isolation off the base, where they are in various stages of recovery from their illness.
There are another 145 people from those flights or ship that the CDC is monitoring for any symptoms right now at Lackland Air Force Base. The governor says the Department of State Health Services is now preparing state labs to administer tests for the virus. However, it's actually local health agencies that are monitoring any possible new patients.
Returning travelers contact their local health departments daily to report their temperature and any other symptoms. DSHS works directly with the CDC lab to identify persons who should be tested and coordinates with the CDC when test results are reported back to the state.
The health department says they currently receive 3 manifests per day from the CDC and Texas Department of State Health Services identifying people in Travis County who recently traveled to China. Anyone identified is given what's called a control order, requiring they minimize interaction with others for 14 days. However, so far, Austin Public Health says no one has tested positive for the virus here in Travis County.
There's a tremendous amount of work that all these state agencies, the state health leaders and emergency response leaders have put in for well over a month now to be extremely well organized. But they did not start from the beginning a month ago. They built upon knowledge gained in responding to the Ebola challenge as well as the H1N1 challenge. And so they come with batteries included when it comes to being able to respond to this.